Hi everyone. So another week's gone by, and this week's statement from the Prime Minister has confirmed that our country really is now facing an unprecedented challenge. The NHS is at the centre of that challenge, and it's both our privilege and our duty to do everything we can to care for each other, our service users and our local communities. Over the past few weeks, we've seen this being played out across our hospitals. Managers and clinicians alike have moved heaven and earth to rise to the growing challenge, and I've never seen so much change being enacted in such a short period. We've changed our working practices, brought in new equipment, designed new operating procedures, produced a whole range of guidance and advice, and at the same time we've increased our communications with staff and our public, using the web, digital and all sorts of forms of social media. All this hard work really has put us in the best possible place to be able to cope with what will undoubtedly be the greatest challenge that most of us will face in our working lives. I couldn't be more proud to belong to the NHS, and I could not be more proud of all of you. In my message to you last week, I made a promise that I and all the senior leaders across both trusts would do everything possible to support you in carrying out your various clinical and non-clinical roles. We also promised that we would ensure that as more information becomes available, we'd make it available to you, always working to clarify what it means for us here within Bournemouth and Poole. Today I'd like to reinforce the fact that in belonging to the NHS, each and every one of us is an essential worker. We have never been more needed in these challenging times. The top priority for the Trust is to ensure that all our staff stay safe so that they're able to provide the care that our patients need. In this context, the top priority is to ensure that we all adhere to our control of infection policies and procedures. Much work has been going on over the past week to ensure that our teams have all the essential equipment that they need, that staff are clear as to what's required in the different clinical areas, and to ensure that all staff are fully trained in the right procedures. Please be assured that our policies and procedures are all in line with national guidance, based on best practice and good evidence. In this way, we can be assured that our staff are properly protected in carrying out their duties. It's so important that we adhere to this so that all our equipment is used to best effect. In addition, we're now asking all our staff, wherever possible, to follow the government guidance on social distancing in the workplace. This means that wherever we can, we want to stay 2 metres away from our colleagues. Now, I appreciate that in some situations that's simply not possible, but wherever you can do this, do this. We've also taken a number of steps this week to create more opportunities for staff to work remotely. We've really expanded our IT. We're asking all our staff to review their work patterns and arrangements to try and reduce the numbers on duty at any one time, whilst of course maintaining essential cover. So if staff want to work from home and they're able to do so, they can free up space in the offices to create just that better chance in social distancing. It also means they're doing fewer journeys, and in this way we can do our part to reduce that curve. However, it's so important that everyone remembers we are an essential service. We're a critical public service and all our staff are essential. We need to make sure that we're continuing to support all our frontline people as they prepare for this big surge. So our priority must be to support more than ever our frontline colleagues in order to help them to keep going. Many of you will be asked to take on new roles or different tasks over the next few weeks so that the hospitals can maintain safe services. So as we seek to do more social distancing, it's really important that our flexible working arrangements don't create more pressure for our clinicians. We're hugely grateful to our frontline staff, and I would like to ask everyone, whatever your role and wherever you're working, to think how you might provide more support to frontline staff during these turbulent times. So whatever your role within our hospitals, I'd like to take this opportunity to say a massive thank you to you. I simply can't thank you enough for your ongoing commitment and sheer hard work as we seek to keep our services running really well. And isn't it encouraging and heartening to see how much we're appreciated by local people? We have been inundated with gifts and offers of support, which is truly, truly moving. So I know that I speak for the wider public and all local people in thanking for your efforts. Do keep going, and we are going to come through this. Thank you.